Hi everyone, I'm Jomcy. Welcome back to Learn with Jomcy. Today's Adult Nursing NMC OSCE topic is a new skill station, Pre-Operative Check. In this video, I will guide you clearly through the pre-operative checklist exactly as expected in OSCE. In this station, the skill is pre-operative check. The duration is 10 minutes. Your task is to complete and document pre-operative checks. In the exam, you may have a patient actor or a mannequin, so always communicate clearly as if it's a real patient. Now, the scenario: you are a nurse in the surgical ward. Mr. Kensley is planned for an appendectomy today. Your job is to complete the pre-operative checklist and finish all required documentation. For documentation, you will complete the pre-operative checklist and the BMI chart. So throughout the station, you must not only check the things verbally, but also document it properly. Let's understand what the examiner is marking. First, you must introduce yourself and explain why you are doing the pre-operative check. Like, hello, my name is Jomcy. I'm one of the nurses looking after you today. Before we begin, can I please check your full name, date of birth, and address? Thank you, Mr. Kensley. Today I'm going to complete your pre-operative check to make sure everything is safe and ready before your surgery. This will take about 10 minutes. Is that okay with you? Second, you must check all of the following like identification band, allergies, state of dentition, jewelry, fasting status, consent form, makeup and nail varnishes, correctly calculate the BMI, prostheses, implants, theater gown, and any other relevant information. Finally, you must sign, print your name, and write the date properly and maintain professional behavior according to the NMC code. First check is identification band. Ask the patient to confirm their full name and date of birth. Then check it against the ID band, the preoperative checklist, and the consent form. Also check the full name, date of birth, hospital, or the NHS number. What you can say to the patient is, can you tell me your full name and date of birth? Thank you. I'm checking this with your ID band and your paperwork. Next is allergies. Ask the patient directly about the allergies such as medications, letters, iodine, or food. Then check the allergy status on the ID band and the documentation. You can ask her, do you have any allergies like medicines, letters, iodine, or any food allergies? Now assess the patient dentition. Ask if they have any loose teeth, crowns or caps, dentures. Because during anesthesia and airway management, loose teeth or dentures can be at risk. You can ask, do you have any loose teeth, crowns or caps? Do you wear any dentures? Next is jewelry. Ask the patient if they have any piercings. Ensure the removal of all jewelry such as rings, earrings, piercings. If something cannot be removed, you should tape it, document it, and escalate. You can ask, are you wearing any jewelry, including rings, earrings, nose studs, or religious items? Do you have any body piercings? If yes, you can tell them that we may need to remove these before surgery for your safety. Now check the fasting status. Confirm the last intake of the food and fluids. Check the compliance with fasting guidelines. For example, 6 hours for foods, 2 hours for clear fluids. Explain the importance of being nil by mouth. And ask when was the last time you had food? When was the last time you had a drink? Next is the consent form, the completion and the accuracy. Check the consent form for correct patient details, correct procedure and site, signature of the patient and the clinician. If it is incomplete or inaccurate, you must escalate. Ask, have you been given information about your procedure? Can you tell me in your own words what procedure you are having today? Do you have any questions related to the procedure? Next is consent form for the patient understanding. Ask the patient to explain the understanding of the procedure, risk, alternatives. If anything is unclear, escalate to the surgical team. Ask, have you signed the consent form? Then confirm. I can see the consent form is completed and signed. Next check is makeup and nail varnish. Ask the patient and check the removal of the makeup, nail varnish, and the false nails. Ask, are you wearing makeup or nail varnish today? Do you have false nails or gel nails? If yes, tell them that we may need to remove these before surgery for your safety. Now, body mass index. Ask the patient for their height and weight, then calculate the BMI using the chart provided. In OSCE, make sure you calculate it correctly and document the BMI clearly. Next is prosthesis. Identify and remove is there any hearing aids, glasses, contact lenses, artificial limbs unless required. Ask, do you have any prosthesis such as hearing aids, glasses, contact lenses, or wigs? Then label the removed items and document the storage as well. Next is implants. Ask if the patient has any pacemakers, cochlear implants, metal implants. Document and notify the theater team. You can ask, do you have any implants? For example, a pacemaker, metal plates, screws, or any joint replacements. Next is theater gown. Ensure the patient is dressed in a clean theater gown. Maintain the dignity and privacy. You can ask like, I can see you are wearing a clean theater gown. I will ensure your privacy and dignity are maintained all the times. Finally, check any other relevant informations. Examples include pregnancy status, current medications like anticoagulants or antibiotics, any infections like MRSA, mobility issues, communication needs, and safeguarding concern. You can ask, is there anything else you think we should know before your surgery? And do you have any concerns or questions at the moment? After completing all the checks, finish your documentation. Sign the checklist, print your name clearly, add date and time. That's the most important thing. That's a complete pre-operative check OSCE skill station. If you want more OSCE videos, subscribe to Learn with Jomcy and stay updated with the latest NMC CBT and OSCE structure. Thank you.